can you describe for us what happens during an abortion?
So in a first trimester abortion, normally it's called an aspiration abortion, the surgical kind. It's called an aspiration abortion or D&C with suction, and you insert a plastic tube up into the uterus, suction and suction everything out. The other would be the abortion pill, which has actually become more common, even though it's riskier and has more complications for the patient, where you just take a pill and it causes, several pills, and it causes miscarriage. Once you get past about 14, 15 weeks, the baby's tissues are too strong to be easily go through a suction cannula, and that's the point where an abortionist would use the D&E with a D&E, or dilation and evacuation, commonly called a dismemberment abortion, because literally you reach in and just pull off arms and legs and finally crush the body and crush the head to get the baby out. Now, that can't be done as an emergency. It normally takes a day or two to get the cervix dilated enough to do that procedure. But at about 23 weeks, again, the baby's tissues are too tough. They've got bones. It's too hard to do that procedure, and that's why they do an induction. So an induction abortion is basically just like when you go in and get an induction because you're past dates or whatever, and just, they put you into labor and you deliver your baby. Well, they do the same thing in an induction abortion. Normally, or often, they will give a medication to kill the baby first, because in 50% of the cases, those babies will be born alive. And that's the unforgivable complication. They don't want a live baby when they're doing an abortion. More recently, and there's a documentary out on it now, there are cases where they're doing that purposely. They're not giving the fetus side to kill the baby because they want the baby's organs to be pristine. They don't want to give something to kill the baby first because they want those tissues fresh. And that's just appalling. But that's a little.
If I can interject and ask for the reason, what ends up happening to those organs that they want to keep fresh?
Well, they're used for research. There was a big thing about University of Penn. In the documentary that David Daleiden did, there was a young girl who was basically railroaded into signing these papers and signing things she didn't know what she was signing. And they basically took this baby that had a heartbeat, and the baby was delivered in about just a couple of minutes. And the records are very sketchy, but the only thing we could determine was that they probably had induced the baby, and just that either the baby fell out or was expelled and then taken off by the people that were going to harvest her organs. And we suspect that baby was alive at the time. Now, can we prove that? No, but boy, the timing was such that it's very suspicious.
And you use the word harvest. Does that imply an exchange of money in this scenario?
That's very hush-hush because it's illegal. But again, I think David Daleiden had video evidence of money passing hands. Now, obviously, the patient didn't get any money, but her abortion was done, quote, for free because she, quote, agreed to donating her baby's body parts, which she had known, she did not understand that that was what was going to happen.
Is that a standard question on the forms that women read before they undergo an abortion?
That I don't know. I don't think that's necessarily the case.
And then,
There was a special form that they had that it appeared that was given to her just as they were, she was in terrible pain and was being rolled into the um, procedure area.
and then if, and I know this is sort of out of the scope of where you practiced, but do you know what women are told in terms of what will happen in those later term abortions? What are they prepared to undergo, or what is explained to them in terms of what will happen step by step, just as you explained?
Well, hopefully they will be told, what's going to happen, and basically they're given medication that's going to make their uterus contract, and they're going to go into labor just as someone who is planning on keeping their baby. The difference will be that the baby will hopefully be born dead, or that's what they're hoping. But that's why these laws that are there to protect babies that are born alive are so critical, because there are babies that are surviving. And in the states that require you to report if the baby was born alive, they're finding that there are survivors. And as a matter of fact, there's a whole organization, and they had an ad at the World Cup that they get up and say, I was a choice. They're the survivors of abortion. Should I not exist? It's very moving.
That's right. So powerful to hear their voices, for sure. In your experience, why do women have abortions?
Well, it's interesting. All of the abortions that I did were completely elective. They just didn't want to be pregnant. And it's interesting, when they did a study looking at late-term abortions versus early abortions, the reasons were about the same. Now, most of the time people say, well, late-term abortions are done because of fetal anomalies, or because the mother's health is at risk. If the mother's health is at risk, you just deliver the baby. You don't have to kill the baby. You just deliver the baby. Now, the baby might not survive, but you're not actively killing that baby. That baby has a chance.
And I'm also curious, did you ever get the sense from a woman, or hear directly from her, that she was under pressure, that this really wasn't her choice at all?
Well, I think that's happening more and more with the amount of human trafficking that's going on, and especially with the availability of the abortion pill. I am sure that there are quite a number of forced abortions, because they got to keep these women working, and they don't want them pregnant. So that really facilitates having the ability to do that, to cause those abortions without their consent, really facilitates the whole human trafficking issue. I started to say that the reasons that women have abortions late at term are the same as earlier. One, they just don't want to be pregnant. Sometimes there are young girls that they don't know that they're pregnant. I had a 16-year-old come in my office, and she was complaining of abdominal pain. She was in labor. Neither she nor her mother, she was a little heavy. Neither of them knew she was pregnant. So that's one thing. Oftentimes they will say, well, late-term abortion is necessary because, the mother's health. But again, you just deliver the baby. The other is fetal anomalies. And women are told, oh, your baby isn't going to survive, or they'll have a terrible life, or they'll have terrible pain. When, oftentimes with all the new technology, they're picking up all this stuff, and sometimes it's not right. So there are healthy babies that are being aborted. There are babies being aborted for very minimal abnormalities. People want a perfect baby. Is that something we really want to be doing as a society? Um, Even in the cases where the baby may die in utero, it's much more damaging to the mother to put her in a position where you're telling her she needs to abort her baby for her baby's good, um, than it is to have somebody like perinatal hospice come along who can counsel her and prepare her for that inevitability. The thing is, she knows that she has done everything she could to give that baby all of the life it was going to have. So even if that life is just in utero, psychologically, that's much better than to know that you killed your child, even though it was for, quote, good reasons. Um, and and also prepare them for the fact that the baby may live, and help them through that. But most of the time, it's that, one, doctors don't want to be sued for wrongful life, or um, have the patient upset with them because their baby has some deformity. And, we forget, and I guess if you don't believe in God, it's more difficult, but we forget that God can help us get through anything. And it's interesting. I met a woman at one time when I was testifying, and she had cared for a baby that died at about 3 months. And the mother had been given a bad perinatal diagnosis. She chose not to abort her child. Um, she delivered her child, but she had 3 other kids, so she knew that she couldn't devote the time needed to care for this baby. And this other woman volunteered to take care of that baby. And she said she was blessed by the experience, and the mother was blessed by the fact that she did not have to kill her child.
And if only those stories were told more often and more loudly than they have been, because I'm sure there are so many of them. And
Yeah.
it's only, the very select few that, in this case, here in Massachusetts, it really was one really tragic story of one woman that really motivated our legislators to pass this bill. And I know for a fact that no other voices were included, such as the woman that you just um, told us about in that story. So it is important, and that's why we're glad that you're helping to convey that side of the story. And one other, yeah, go ahead.
Well, and even in that case where the baby has a stroke in utero, they had no way of knowing how, if that baby would be affected or not. Yes, oftentimes they are affected, but the brain has amazing potential to heal. And yes, that baby might have had some learning disability. That baby could have had cerebral palsy. There are things that could have happened, but it wasn't absolute. She could have chosen to and if the baby had died in utero, at least she would not have killed her child. But she could have chosen to just deliver the baby naturally. And if she didn't want to handle the baby having disabilities, then she could always adopt that baby out. There are people who are willing to adopt babies with disabilities. As a matter of fact, there's a waiting list for babies with Down syndrome. So
Really, I
yeah,
did not know that. Oh,
yes.
that's amazing.
So there are other options besides killing the baby. And the bottom line is this a person or not? And if it's a person, why are we treating them differently than other people? You would not kill your child if they had a stroke in the neonatal unit. You would not kill your child, you know, at any time once they were born. So what's the difference in a few hours? What
And
changed?
Another component of this that hasn't really been included in the conversation is the fact that not every prenatal diagnosis is accurate.
That's
And,
right.
and there are many where the baby ends up being born and has no disabilities whatsoever, is perfectly healthy, or
Mhm.
maybe has some challenges to deal with, but nothing that is life threatening. And
Yeah.
so, in other words, in your experience, do doctors get it wrong?
Oftentimes, I think they get it wrong, and they do not want the liability. And I think, unfortunately, I think that's, behind a lot of the referrals for abortion in cases where there's some abnormality. Um, my daughter, with both her children, they said they had cysts in the brain. They said they had some sort of cardiac issue. Um, and it all turned out to be nothing. Thankfully, they weren't, pushing for abortion. But like I said, the technology is such now they can pick up all kinds of things. And depending on how worried the OB is about getting sued, they may, be more inclined or less inclined to push for abortion because then it's a non-issue, which is so sad. But there's never any true reason for these late abortions because you could just deliver the baby, and then deal with whatever it was. You don't have to kill them.
So I'm going to skip ahead to a question I had for a bit later in the conversation. But as I mentioned earlier, the medical community here did push for this legislation quite broadly. The Mass Medical Society, the Health and Hospital Association, Mass General Brigham, UMass Memorial Health, Tufts Medicine, and Beth Israel Lahey all were very vocal that this late term abortion bill should be passed. Your description of the concern among OBs regarding lawsuits, do you think that played a role?
I'm sure, but I think more than that is oftentimes physicians don't want any regulations, any interference with what they want to do. And I think that's probably the biggest issue. Now, the thing is, we're one of the most regulated professions that there are, but it seems that especially in this issue, they want no interference. And what amazes me is how skillful um, they are. I'm not sure who it is, but how skillful they are with language. And so, as I was reading some of the articles about this bill, they talked about these, women not being subjected to these terrible, heartbreaking situations, and the physician should have. And they always say the physician. They don't say the abortionist
Of
because
course not.
oftentimes it's the abortionist making the decision, and they're the one making the money. Um, but yeah, physicians don't like to be told what to do.
Okay, not much to add on to that. So the phrase professional judgment is one that really stood out to a lot of people and really defined this bill apart
Mhm.
from other legislation that has passed here in recent years. Um, and it really is the phrase that allows abortionists to perform abortion up to birth because it will be in their professional judgment. Um, Again, this is on a woman for any reason.
Mhm.
Healthy mom, healthy baby. Um,
Mhm.
in your professional judgment, and I think you touched on this earlier, but I just want to hear it very specifically from you. In 2026, in your professional judgment, is a late term abortion ever necessary medically?
Never. Like I said, all you do is deliver the baby. Before we could do abortions that late, what did we do? We delivered the baby. We took care of the baby. We didn't put it on a cold tray and stick it in a closet so the baby would die. We took care of the baby. And if the baby didn't survive, then the baby didn't survive, but you knew that you had done your best. Um, there is no reason, and it's not like you're saving the woman anything. She still has to go through labor. She may end up with an episiotomy. She may end up with a C-section because things go awry. You're not saving her anything, and you're giving her a lot of heartache. It's one thing to maybe have a very early abortion where you don't know you're pregnant. But late term, you've been carrying that baby, you've been feeling that baby kicking inside, and then to kill the baby, that's pretty hard to deny. And we now know that women suffer psychological problems afterward. There's more suicide, more anxiety, more drug use, because you can't kill your child and remain unscathed. You are going to have some problems. Now, initially, they may feel relieved, that they've had the abortion, but eventually it comes back to haunt them. And oftentimes, either when they try to get pregnant and they can't because of some problem with the abortion, or they do successfully get pregnant, and then they wonder, what would that child have been like, And those are oftentimes, or some other death. Some of the abortionists that have stopped doing abortions, it's been after the birth of their child, which was the case for me. Dr. Levatino, his adopted child, was killed in an auto accident, and and suddenly, if you talk to him, he says, suddenly I wasn't just removing pieces of tissue. I was, he said, this was someone's son or daughter. And so when that preborn baby becomes human to you, then you can no longer just kill it for no reason.
When you were performing abortions, when a woman was regretful, in pain, mourning, hurting, if she came to you, what did you tell her? What kind of time did you spend with her to counsel her, to listen to her, to offer her support for those psychological issues that had developed because of her abortion? What did you do as the abortionist to comfort that woman?
As the abortionist, nothing, because I was there basically, I was in a clinic, I was there to do the procedure. I never saw them afterwards. So yeah, nothing. Now, later in my practice, after I had stopped doing abortions, I did see many women who had had abortions and were coming back to me because they were still bleeding or having pain. I had one young woman who got pregnant. She had, as soon as she found out she was pregnant, she immediately went and had an abortion. And she was seeing a psychiatrist because she could not, she couldn't get over the fact that she had killed her child. And she said, the thought that I killed my child was much more traumatic than the thought, oh, I'm pregnant, and I would just have to, refer those women to people that could help them. And I would say anybody that's had an abortion, if you're listening, if you've never talked to someone about it and gotten some healing, it's something you need to do to be able to go on with your life. I just wish more women would be brave enough to come out and say what abortion has done to their life.
I think that's one of the most tragic aspects of the whole topic, is that women aren't supposed to feel sorry or even feel at all, unless it's joy, unless it's the willingness and the desire to shout their abortion and be an activist. And I think that is such an additional disservice and almost criminal on top of even suggesting the abortion in the first place.
I think that's true. There's it's like this hidden thing that you can't talk to anybody about, you're embarrassed about, and it just sits there and eats away at you.
So when you were performing abortions in the 12th, 13th, 14th week of pregnancy, so that's almost into a complete fourth month, you clearly saw the baby's body parts and you recognized the humanity of that child. How did you justify performing abortions?
So for some reason, I did not see their humanity at that point while I was doing them. All I thought was, I'm helping this woman. My reaction to the body parts was very similar to that of Abby Johnson. If you saw the movie Unplanned, she and I both, it was like, oh, this is such a perfect little foot, such a perfect little hand. I thought they were beautiful. I liked sending the tissue down to pathology so I could see what things looked like at a cellular level. I didn't see those babies as any different than the chick embryos we dissected in college. I was looking at it from a completely scientific standpoint, and doctors are taught to compartmentalize, and I had done that extremely well. It wasn't until later I read an article comparing abortion to the Holocaust, and I realized the reason that I could be so detached and do such terrible things, tearing little babies limb from limb, that's what I did. I could do it because I didn't see their humanity. I didn't consider them human beings. And so just like the Nazis, I could do whatever I wanted and not feel guilt, not feel regret. Not until, that point where the light bulb went on.
And what was that moment like?
Well, all of this, I mean, that was horrifying. All of a sudden, I saw myself as a mass murderer. That was when Ted Bundy, a serial killer, was in the news and they were getting ready to execute him. And I thought, wow, I've killed a lot more people than Ted Bundy, and they're not executing me. But it's interesting because it was after the birth of my child that I realized I could no longer kill abortion. I could no longer kill babies just because they weren't wanted. But I think it took it took him a little longer to completely turn the light bulb on and show me what exactly I had been doing. And so at that point, I became pro-life. Prior to that, it was still very pro-abortion. I just couldn't stomach doing it myself.
And this was your job. It was a professional decision that you had made as a medical practitioner, and you were compensated.
Yes.
We're not really supposed to talk about the profit motive or the fact that organizations like Planned Parenthood have revenues that are increasing every year because abortions are increasing. Can you talk a little bit about that component? Is it something that you think the public isn't aware of?
I'm not sure if they're not aware, they choose not to really look at it. It was much more lucrative for me during my residency to moonlight in an abortion clinic than to moonlight in an emergency room helping people. I also felt like, well, I'd be helping women doing this, and that's why I chose to do it. But the finances were also an issue. But abortion is big business. Fetal organ harvesting is big business, even though it's not supposed to be. It's big business. These researchers pay top dollar for these body parts. And I keep wondering, why are we listening to the people who are making money off abortion? Why is that the biggest voice? Why not listen to the people who make no money? Pregnancy centers have been pregnancy resource centers have been so maligned, and yet they're the people that are not making any money. They're there to help in any way that they can, and yet they are demonized. And yet the people that are making all the money, they're the good guys.
That is probably, the most challenging ongoing reality in all of this, especially after bills like this one that we've just seen here in Massachusetts. After legislation like that passes, knowing that there is a revenue motive behind it, and yet on the other side are these centers waiting to help and charging nothing for their
Yeah.
services, and like you said, being demonized for it. It's really it's difficult. It's so unjust. And yet we keep working and promoting those wonderful pregnancy centers because women have to have another choice. And that is a wonderful choice to have. So yes, they do great work.
And and the thing is that so many women will make that choice to keep their child if they have enough help. And I really have to applaud Governor DeSantis, because one of the things he did was pour millions into helping young families, helping single mothers. And that's what we've got to do is really help young women so that they can choose life. They can choose to keep their baby. And for many, that's what they really would like. And yet people who give them that option, who are willing to help, like I said, are demonized. They're the bad guys. They're trying to convince them to do something they don't want to do. No, they're just giving them options.
Right. The choice.
A
The choice.
choice.
It's supposed to be a choice.
That's the
Yes.
true choice. Yeah.
So ironic. I don't know, when you were researching the bill signing that happened here, if you can picture in your mind the photo of Governor Healy signing the bill, and behind her stood a handful of women who were downright gleeful, smiling, applauding, cheering as the governor signed this bill that allows abortion up to birth outside of a hospital setting for any reason. Healthy mom, healthy baby. There are cheers from these women. If you could send a message to that group of women, what would you want them to hear?
Oh, I don't know. It's just, you're so deluded. I think it's just evil. Um, one day, one day you will wake up and say, what have I done? What have I helped to create? I think someday they will have major regrets. Now, perhaps not, perhaps not, perhaps they'll go to their graves thinking they did the right thing, but uh, to me, it's just evil.
And most importantly, what would you say to a woman who might be seeing this and is terrified because she is in a situation that she feels trapped within, whether she has received a frightening diagnosis about her unborn child, whether she is being pressured by her family, by her parents, to abort a perfectly healthy child?
Mm-hmm.
What do you want a woman to know?
One, I would contact a pregnancy resource center, because they have the ability to help and to give her really viable options. Had I known about the adoption, these open adoptions that they have now, I may not have gone through with my abortion. It's amazing. You can get a video of families that want to adopt your child. You can choose who gets to adopt your child. You can choose whether you want to be a part of that child's life or not. I mean, it's absolutely amazing. I was brought up with all these movies of these mothers giving their babies up, the babies being torn from their arms and them never seeing them again, and them regretting the rest of their life, giving up their child. And it doesn't have to be that big. And I think adoption is um, option. And I guess that's it. Just there are options that will be better for her than having an abortion and having to live with that.
You have offered some wonderful, very experience-based thoughts and comments. Is there anything else you'd like to add?
No, just that language is so important, and these people are experts in crafting language, and it all sounds so good, so helpful, so compassionate, but it's not compassionate for the child. And the bottom line is this a human being or not? And if he or she is a little human being, why are we snuffing out their little lives with, for even no reason? Um, that's really the bottom line. I hope we never get to the point where they have in the Netherlands where we're willing to kill them even after they're born. But we may go there, because once you start killing innocent babies in the womb, it's a very short jump to killing old people, people with disabilities. Would we kill a teenager that has a disability? Well, why are we killing a preborn baby with a disability?